It's wonderful to be here on the last day and the closing out session for the wonderful seminar we've had for the last 4 days. It's been amazing to meet and connect with folks here. I'm going to describe how virtual health technology is transforming the way primary care is being delivered. But I want to share a little bit about how I got to this point. I'm a physician. I'm an internist and an emergency physician. I've practiced and taught medicine in academic and community settings. But I'm also a nerd, and my mission in life was to use technology to improve the way doctors and other healthcare professionals deliver care. So I studied computer science, and I got the PhD at Stanford. Then I got the faculty job, the tenure-track faculty at Harvard Medical School. I was at Beth Israel Deaconess Medical Center, and then I got the NIH award, and I focused on creating, using technology, creating models based on causal probabilistic knowledge-driven models combined with numeric simulation models of cardiopulmonary physiology, built a decision-theoretic treatment planner for patients in the ICU based on optimizing a multi-attribute preference model. But in the end, I realized this system was not going to have a big impact, not going to reach very many people. And so I left my job at Harvard, and I came back and joined a fledgling startup at California. And this was in the era when the internet was new, and we wanted to use the internet to disintermediate all of the healthcare providers and make healthcare better. And although that initiative had some issues, one thing we did was we said we should make health information available to consumers. And I had the pleasure of building the first consumer health website at a company called Healthion. And you've probably heard of it because you know it today as WebMD. I subsequently went on to work at Hippocrates, where I was head of product and demonstrated that doctors would use mobile devices at the point of care to improve the way they delivered care. I put those two together when we created HealthTap back in 2010, based on this premise and this understanding that healthcare was going to be available on mobile devices, and we wanted to be there first. So it turns out the journey has taken us to the realization that virtual primary care can be delivered on our healthcare devices. We first implemented a digital urgent care service in all 50 states, 24/7, back in 2014. We had an interesting journey. We implemented that platform in many other ways. We did it in South Africa, we did it in New Zealand, we did it in England and Hong Kong, and we started in Australia, until we realized as a company that actually the value in virtual care was in virtual primary care. And what is it about primary care that is so important? And why is it that we're now on the cusp of a transformation of primary care to virtual primary care? Well, it turns out, as others have commented on this meeting already, that when you have primary care, when people have a relationship with a primary care doctor, they get more preventive care by substantial margins. They have dramatically higher confidence in things like vaccines, almost double the rate of vaccine confidence among people who actually have a primary care doctor that they know. And as has also already been mentioned, healthcare costs go down. One study is really quite remarkable, looking at, for each primary care visit, what the annual change in healthcare cost is, and some studies show more than $700 for each visit. But if you look at the high-risk patients, it turns out that a single primary care visit reduces healthcare costs by more than $16,000. And of course, as we've also commented, people live longer when they have a primary care doctor. It's quite striking. In the rural or underserved areas where there aren't enough primary care doctors, had primary care at the same level as are found in urban centers, that people would live on average about a half a year longer, which is quite striking. A report published just yesterday by Fair Health, reported on an Axios, indicated that something like a third of all people who get health care don't actually have a primary care physician. And although we have a specialist for every problem, the reality is that it's the primary care physician that supports and encourages preventive health and actually leads to significantly longer life. So given the value and obvious benefits of having primary care, we would be focusing on this a lot, of course, wouldn't we? Well, no, it turns out we're not enough. there's a shortage, and the AFP says that over the next 10 years there could be up to 48,000 too few primary care physicians. We're simply not paying enough attention, and the rural areas are hardest hit. There are places, healthcare deserts, where you just can't get care. There aren't any primary care doctors or other healthcare professionals available. And as a result of not having enough, workloads rising, and doctors' lives are being focused on being pushed to more productivity. Higher productivity means less time with your patient. This is not satisfying for doctors. It's leading to burnout and making it harder as doctors are leaving the field because it's so unpleasant, leaving more work behind for those who remain. So burnout is a problem in primary care. So it turns out that virtual primary care is at least part of the solution, maybe a big part of the solution to not having enough primary care. It turns out that virtual primary care is more convenient. It's actually as or more effective than in-person primary care for most people. And interestingly, it's far less costly to deliver healthcare virtually. And of course, when you have virtual care, it's equally available in areas that currently don't have access to sufficient primary care. And the most exciting thing for me is to see that how much both doctors and patients love getting care virtually. Some of this is counterintuitive. It turns out, though, that virtual care has many measured benefits. It improves adherence and follow-up to care compared to traditional office-based care. The concerns that there would be excess numbers of prescriptions written virtually have turned out not to be true. People were worried it wouldn't work for seniors, but it does. We see that the largest rising segment of users of the population, and even for people with dementia, when they have a care provider, they can still be guided to use virtual care from home. And again, the most important thing about virtual care is it actually leads to relationships of trust and caring. So virtual care is turning out to be just wonderful. And who are the doctors who are interested in doing this? It turns out that the doctors who most want to be the traditional doctors connecting with their patients and delivering longitudinal care over time with their patients are flocking to the service and finding it incredibly rewarding. Let me show you just one example. This is Dr. Koja Karu, one of the doctors on HealthTap. She's a well-trained internist. She's got 20 years of experience. She used to be a hospitalist. She's worked in ambulatory care settings. She lives in Las Vegas and needed a more flexible lifestyle. In particular, her parents who are aging live in Romania. And she wanted control of her lifestyle and the ability to actually travel and take care of her parents when she needed to. So she works with us, and whether she's at her home in Las Vegas or whether she's visiting her parents in Romania, her patients don't know the difference. She connects virtually over the internet with the server. Of course, all the data and security remains on the US server, but she connects to us from her location. Interestingly, you can tell from what people say about her how much she enjoys giving healthcare, and the reviews are stunning. I would invite you to actually go to HealthTap and look up at her profile. You can see the most recent in order, and you see I'm not cherry picking her reviews. They're all like this. It's just amazing. She was awesome. She's amazing. What a wonderful experience. Wow, she's amazing. She's treating me for multiple concerns. She's the best doctor I've ever had. She's treating me. It's remarkable to see what people say. I wanted to give you just a couple of examples to show you kinds of things that are actually happening in virtual care, which may be a surprise to some of you. These are cases I saw personally in my virtual primary care clinic. Here's a gentleman who showed up. He actually had already done an ultrasound of his leg. He's a contract worker, spends too much time sitting at a chair at home, developed pain and swelling in his leg, was concerned. He actually got an ultrasound and a D-dimer to measure the degree of clotting in his blood, and both were off the charts. The ultrasound, I appreciate, difficult to see here, but it shows clot in an enlarged popliteal vein. So I was able to start him initially on an oral anticoagulant, and he got better very quickly and was quite grateful to the process. He had no insurance, no access to care. He was afraid to go to the ER, and he had a problem that could have killed him. But as a result of getting appropriate therapy right away, he did very well. Here's another example that may surprise some and follows on our discussion about the care of diabetes. Jorge is a 44-year-old Hispanic gentleman who works as a driver for Grubhub. He lives in the Central Valley. He has no health insurance and quite modest means. He knew he had type 2 diabetes. He'd previously been placed on metformin and glyburide, and he knew he was worse. He felt bad. He was peeing a lot, hungry, dry mouth, fatigue. And he knew he had a problem. He was afraid. He didn't have enough money couldn't see a doctor. So his partner convinced him to do a consult, and I met him on HealthTap. And after connecting with him and describing what was happening, generated enough trust that he was willing to start on insulin. And so we did this virtually via video. He got them supplies, and I taught him how to draw up and then self-administer insulin, and then managed his dose over the next few weeks. On HealthTap, once you connect with the doctor, you can send them text messages. So you can have free, unlimited texting between the doctor and a patient. The doctor gets to manage how that works. So I encouraged him to send me his routine blood sugar measurements, and we adjusted his dose. And over a few days, we got his blood sugar down. And as you can see from the chart, we achieved essentially normal blood sugar levels virtually with a gentleman at incredibly low cost compared to him, compared to what any other option might have been. And finally, I'll end with a comment of the last patient here. Janie is a very high-functioning 46-year-old Asian executive. She lives in the Sacramento area, actually commutes to work in the Bay Area. And she has multiple complicated medical problems. One of the most challenging and interesting internal medicine patients I've had the pleasure to take care of. And she read an article I wrote. It was entitled Myths and Misconceptions About Virtual Primary Care. And she sent me a note, she said, "Geoff, you missed something. I want you to go and update that article." And these are her words exactly. She said, "I want you to say that telemedicine can work for patients with complex medical history, because a PCP who's familiar with the patient's case can better prepare patients for specialty visits and be more effective at coordinating their care." So our patients are telling us this is working. Our doctors are telling us this is working. It's a solution that makes doctors happy, patients happy, and allows us to distribute primary care to all the places it needs to be. And so I make the point, and I'd like to repeat, that virtual primary care is in fact transforming the way primary care is being delivered, enabling the widespread delivery of a more convenient form that's more effective and highly affordable for healthcare. I put a link here to a set of sources, resources, and references that give you data around the various assertions I've made here today. I welcome you to look at it. There's actually a bit.ly link, bit.ly/virtual healthcare, which will give you the same information if you're interested.